Are you suffering from sciatic nerve pain that runs down your leg and can't find lasting relief? If you're over 60 and wake up in the middle of the night with this intense pain radiating down your leg, know that there's a very specific mistake most older adults make without realizing it, and it's completely sabotaging their nights of sleep. Today, I'll reveal exactly what this fatal mistake is that's turning your nights into a nightmare and how you can correct it today to finally get the rest you deserve. I'd love to hear where you're watching from today. Leave a comment below telling me where you live and how long you've been suffering from this nighttime sciatic nerve pain. Your participation is crucial for our community of people seeking natural relief from this condition. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips on how to naturally treat sciatic nerve pain, especially those geared towards seniors who face unique age-related challenges. The sciatic nerve is the largest and longest nerve in the human body, extending from the lower back, through the buttocks, down the back of the thigh, and all the way to the feet. When this nerve is compressed, irritated, or inflamed, the result is pain that can range from mild discomfort to a burning or electric shock sensation that literally keeps millions of people awake at night. Epidemiological studies show that the prevalence of sciatic pain increases significantly with age, affecting approximately 15 to 20% of people over 60, and this percentage rises to over 30% in those over 70. The anatomy of the sciatic nerve is particularly complex in older adults due to the natural degenerative changes that occur with aging. Starting at age 50, our intervertebral discs begin to lose height and elasticity, which can lead to narrowing of the spaces through which the sciatic nerve passes. Furthermore, the development of osteophytes, popularly known as parrot's beaks, can create points of additional compression on the nerve. The facet joints also undergo wear, contributing to spinal instability and increasing pressure on the nerve roots that form the sciatic nerve. What makes the situation even more complex for older adults is that during the night, our bodies undergo several physiological processes that can intensify sciatic pain. During sleep, the production of cortisol, our natural anti-inflammatory, decreases significantly, especially in the early morning hours. This means that any inflammation present in the sciatic nerve tends to intensify during this period, resulting in the excruciating pain that wakes people up between 2 and 4 a.m. Furthermore, the position we maintain while sleeping for several consecutive hours can create or aggravate compression points on the nerve. Prolonged immobility also reduces blood circulation in the lower back and pelvic region, decreasing the supply of oxygen and nutrients necessary for the recovery of inflamed tissues. For older people, this situation is even more critical due to the natural reduction in circulatory capacity that accompanies aging. The specific mistake I'm going to reveal today is directly related to a nighttime habit that most seniors develop without realizing it, thinking they're doing something beneficial for their health, but which in reality creates the perfect conditions for sciatic nerve irritation during sleep. This mistake is so common that I encounter it in practically all my elderly patients who complain of nocturnal sciatic pain. The good news is that correcting it is relatively simple, but requires specific knowledge about how the elderly body functions during rest. Early identification of this error is crucial because the longer it persists, the greater the sensitization of the sciatic nerve, leading to chronic pain that becomes progressively more difficult to treat. In older people, tissue recovery is naturally slower, so each night of inadequate sleep represents a lost opportunity for regeneration and can contribute to a vicious cycle of pain and insomnia. Recent studies in gerontology show that sleep disorders in people over 60 not only affect quality of life, but also accelerate the cellular aging process and compromise the immune system. When we add nocturnal sciatic pain to this equation, we create a scenario where the body cannot adequately perform its repair and regeneration processes, perpetuating and intensifying the painful condition. The most devastating mistake I encounter in virtually all of my elderly patients with nocturnal sciatica is the incorrect use of pillows to elevate their legs while sleeping. You've probably heard that elevating your legs can help with circulation and sciatic pain relief, and that's true, but the way most elderly people do it creates the complete opposite effect, intensifying compression on the sciatic nerve and turning their nights into painful nightmares. The vast majority of older adults suffering from sciatica place a pillow or two under their knees, thinking they're doing the right thing. On the surface, this logic seems sensible. After all, elevating the legs can improve venous return and reduce swelling. However, when we analyze the specific biomechanics of the spine and sciatic nerve in older adults, we discover that this seemingly harmless practice is creating a cascade of problems that intensify throughout the night. When you place pillows only under your knees, you're creating forced hip flexion that puts the psoas muscle in a prolonged shortened position. The psoas is a deep muscle that originates in the lumbar vertebrae and inserts into the femur. When it remains shortened for several hours during sleep, it develops tension points that exert traction on the lumbar vertebrae, specifically L4 and L5, which are precisely where the nerve roots that form the sciatic nerve emerge. In older adults, this situation is even more problematic because muscle flexibility is already naturally reduced due to the aging process. Muscles and fascia lose elasticity with age, and when we subject the psoas to a shortened position for 6 to 8 consecutive hours, we create adhesions and trigger points that will remain active even after waking, maintaining compression on the nerve roots. Furthermore, the position with pillows only under the knees also negatively affects the natural curvature of the lumbar spine, known as lumbar lordosis. This curvature is essential for proper load distribution on the intervertebral discs and for keeping the intervertebral spaces open, allowing the nerve roots enough room to function without compression. When the knees are elevated without adequate lumbar support, the natural lordosis is reversed, creating a lumbar kyphosis that narrows the intervertebral foramina, directly compressing the sciatic nerve roots. Biomechanical research shows that each degree of hip flexion above 15 degrees increases intradiscal pressure by approximately 5%. When we consider that sleeping with pillows under the knees often results in hip flexion of 30 to 45 degrees, we're talking about a 75 to 125% increase in pressure on the lumbar discs throughout the night. For older adults who may already have degenerated discs or disc protrusions, this increased pressure can be the difference between a restful night and waking up with intense sciatic pain. The problem becomes even more complex when we consider that during REM sleep, which occurs primarily in the early hours of the morning, our muscles experience deep relaxation. While this is normal and necessary for recovery, when the body is in a biomechanically incorrect position, this muscle relaxation removes the active protection that the muscles provide to the spine, leaving passive structures such as ligaments and intervertebral discs bearing the entire load of an improper position. Specific studies on low back pain in the elderly show that prolonged hip flexion during sleep is directly correlated with increased morning stiffness and pain intensity upon awakening. This occurs because during prolonged flexion, the posterior tissues of the spine, including the ligaments and the articular capsule of the facet joints, are subjected to constant tensional stress, developing micro-tears that accumulate over time, particularly in older women who account for the majority of nocturnal sciatic pain cases. There's an additional factor related to postmenopausal hormonal changes. Decreased estrogen levels negatively affect the quality of collagen in the ligaments and intervertebral discs, making these structures less capable of withstanding prolonged mechanical stress. When we combine this structural vulnerability with the awkward position created by pillows under the knees, we have the perfect recipe for chronic sciatic nerve irritation. Another often overlooked aspect is that inadequate leg elevation also affects breathing patterns during sleep. Excessive hip flexion can slightly restrict diaphragmatic expansion, leading to shallower breathing that reduces oxygenation of spinal tissues during the night. Considering that tissue recovery significantly depends on adequate oxygen supply, this subtle respiratory restriction can delay healing and regeneration processes, perpetuating the inflammatory process. The irony is that many older adults adopt this practice based on well-intentioned recommendations from health professionals who have not adequately considered the specific biomechanics of the spine during sleep or the anatomical and physiological peculiarities of aging. What works for general circulatory problems can be counterproductive for sciatic nerve health, especially when applied inappropriately for prolonged periods. The most devastating consequence of this pillow placement error is the development of what I call sciatic awakening syndrome, a specific pattern of pain that manifests in the early morning hours and can persist for several hours after waking. This syndrome is particularly severe in older adults because it coincides precisely with the time when the body should be feeling most rested and refreshed after a night of restful sleep. What happens during these 6 to 8 hours of improper positioning is a cascade of inflammatory events that progressively intensifies throughout the night. When the sciatic nerve remains under constant compression due to incorrect pillow positioning, nerve cells begin to release pro-inflammatory substances such as substance P and calcitonin gene-related peptide. These substances not only increase pain sensitivity, but also promote local vasodilation and plasma leakage, creating edema that further compresses the nerve. In older adults, this process is particularly problematic because lymphatic drainage capacity naturally decreases with age. The lymphatic system, responsible for removing toxins and inflammatory products from tissues, functions less efficiently after age 60. When this reduction in natural drainage is combined with the increased production of inflammatory mediators caused by nerve compression, we create a buildup of harmful substances around the sciatic nerve that can take days to completely eliminate. Chronobiology research shows that our levels of cortisol, the body's natural anti-inflammatory, reach their lowest point between 2 and 4 a.m. This is precisely the period when inflammation caused by improper pillow positioning peaks, creating the perfect storm for waking up with intense pain. For older adults, whose basal cortisol production is already reduced due to the aging of the hypothalamic pituitary adrenal axis, this window of vulnerability is even more pronounced. The typical pattern I observe in elderly patients who make this mistake is this. They manage to fall asleep relatively well, but wake up between 2 and 4 a.m. with intense sciatic pain that prevents them from going back to sleep. When they try to move or change position, the pain intensifies because the muscles and ligaments that have been in a shortened position for several hours resist movement, creating painful stiffness that can last for hours after waking. This morning stiffness isn't simply a temporary discomfort. Histological studies show that when soft tissues remain in a shortened position for prolonged periods, collagen fibers develop abnormal crosslinks that permanently alter the tissue's elasticity. In older people, whose collagen already exhibits age-related changes, this crosslink formation occurs more rapidly and is more difficult to reverse. The piriformis muscle, located deep in the gluteal region, is particularly affected by this positioning error. When pillows elevate only the knees, the piriformis remains in a position of increased tension throughout the night. Because the sciatic nerve passes very close to the piriformis, and in about 15% of the population passes directly through it, any excessive tension in this muscle can mechanically compress the nerve. In older people, where muscle mass and strength are already reduced, the piriformis can develop trigger points and spasms that persist for days after a single night of improper positioning. The situation becomes even more complex when we consider that many older adults take medications that can affect sleep quality and inflammatory response. Medications such as antihypertensives, diuretics, and antidepressants can alter normal sleep patterns, causing the person to remain in a single position for even longer periods. Some of these medications can also affect peripheral circulation, exacerbating problems caused by improper positioning. Nocturnal sciatic pain in the elderly also has a significant psychological dimension that cannot be ignored. The fear of pain can create a state of hypervigilance that interferes with the deep stages of sleep necessary for tissue recovery. When a person develops anticipatory anxiety about nighttime pain, they tend to position themselves even more rigidly in bed, exacerbating the biomechanical problems caused by poorly positioned pillows. Sleep medicine research shows that sleep fragmentation caused by pain has profound effects on the immune system and healing capacity. Each nighttime awakening due to sciatica interrupts the natural growth hormone release cycles, essential for tissue repair. In older adults, whose growth hormone production is already significantly reduced, this disruption can have lasting consequences on recovery. Improper pillow positioning also affects body temperature during sleep, an often overlooked but crucial factor for sciatic nerve health. Improper positioning can compromise local blood circulation, altering thermoregulation in the lower back and pelvic region. Since cellular metabolism and repair processes depend on an adequate temperature, these changes can significantly delay the healing of any inflammation present in the nerve. Correcting this devastating error requires a completely different approach to sleep positioning, specifically designed for the specific needs of the aging body. The correct technique doesn't simply involve removing pillows, but rather implementing a progressive support system that respects the anatomy of the mature spine and promotes sciatic nerve regeneration during rest. The first fundamental element of this correction is understanding that support should begin in the lower back, not the knees. Elderly people often develop a rectified lumbar lordosis due to years of postural changes and disc degeneration. During sleep, it's essential to gently restore this natural curvature to decompress the nerve roots that form the sciatic nerve. This is achieved by placing a rolled towel or a specific lumbar support in the natural curvature of the waist, filling the space between the body and the mattress. This lumbar support should be approximately 5 to 8 centimeters in diameter for older adults and can be adjusted for individual comfort. The goal is not to create exaggerated lordosis, but rather to maintain the physiological curvature that allows for proper alignment of the lumbar vertebrae. When the vertebrae are properly aligned, the intervertebral foramina open, providing enough space for the nerve roots to function without compression. The second crucial component is positioning the legs so that the hips remain in a neutral position. Rather than elevating only the knees, the correct technique involves supporting the entire length of the legs, from the knees to the ankles. This is achieved by using a firm, long pillow, or 2 pillows aligned, that evenly support the entire back of the legs. This distribution of support prevents excessive hip flexion, which causes psoas shortening and nerve root compression. The ideal height for this leg elevation in older adults is approximately 15 to 20 centimeters, sufficient to improve venous return without creating excessive hip flexion. This specific height was determined through biomechanical studies that measured intradiscal pressure in different resting positions. Elevations greater than 25 centimeters were found to significantly increase pressure on the lumbar discs, especially in people over 60. An often overlooked but extremely important aspect is head and neck positioning. Many older adults use excessively high pillows or multiple pillows, creating cervical flexion that extends throughout the spine. An incorrect head position can alter the curvature of the entire spine, indirectly affecting pressure on the sciatic nerve. The ideal pillow for older adults should keep the head in a neutral position, aligned with the thoracic spine, usually requiring a medium-height pillow that adequately fills the space between the neck and the mattress. For older people who sleep on their side, correction requires additional modifications. A pillow should be placed between the knees to maintain pelvic alignment and prevent rotation of the lumbar spine. This pillow should be firm enough to keep the knees apart throughout the night, but not so thick that it forces excessive hip abduction. The ideal thickness usually ranges from 10 to 15 centimeters, depending on the person's hip width. Implementing this correction should be gradual, especially in older adults whose tissues may have adapted to the incorrect position for years or even decades. I recommend starting with subtle modifications, gradually increasing lumbar support and adjusting leg elevation over the course of a week. This progressive approach allows the muscles and ligaments to gradually adapt to the new position, avoiding excessive discomfort during the transition period. It's crucial for the elderly person to understand that there may be a 7 to 14-day adjustment period during which they may experience discomfort that's different from usual. This doesn't indicate incorrect technique, but rather that the body is adjusting to an anatomically correct position after years of compensation. During this period, it's important to remain consistent with the new position and not return to the previous position, even if it initially feels more comfortable. The quality of the mattress also plays a crucial role in the effectiveness of this correction. Elderly people often require a mattress that offers firm support without being overly rigid. A mattress that is too soft will not provide adequate support to maintain spinal alignment, while a mattress that is too firm can create pressure points that interfere with circulation. A simple test is that the person should be able to slide a hand under the lower back when lying on their back, but without creating excessive space. To enhance the effects of this correction, I recommend applying gentle heat to the lower back before bed. A warm compress applied for 15 to 20 minutes can help relax the paraspinal muscles and facilitate correct positioning. Heat also promotes local vasodilation, improving blood circulation in the area and delivering more oxygen and nutrients to the healing tissues. Monitoring results is essential to assess the effectiveness of the correction. Older adults should observe changes in sleep quality, ease of falling asleep, number of nighttime awakenings due to pain, intensity of morning pain, and stiffness upon rising. Significant improvements are usually seen within 2 to 3 weeks of consistent implementation of the correct technique. Important considerations regarding this nocturnal positioning correction are crucial to ensuring that older adults implement the technique safely and effectively. First, it's essential to understand that each older adult has unique anatomical characteristics developed over decades of life, and what works perfectly for one person may require adjustments for another. Factors such as height, weight, presence of other medical conditions, medications currently being used, and degree of spinal degeneration should be considered when implementing sleep positioning modifications. A crucial consideration is that older adults with severe osteoporosis or previous vertebral fractures require special care when making changes in positioning. In these cases, any changes should be made gradually and ideally under medical supervision. Lumbar support should be introduced very subtly, starting with thin towels and gradually increasing the thickness as tolerated. Abrupt changes in sleeping position can cause excessive discomfort or even injury to fragile bones. Elderly people with pacemakers or other implanted medical devices should pay special attention to positioning, especially if they sleep on their side. The pillow between the knees should not force a position that puts pressure on the device. Furthermore, medications such as blood thinners can increase the risk of bruising if excessive pressure is applied to certain areas, so adequate padding is even more important. The presence of other conditions such as sleep apnea, gastroesophageal reflux, or heart problems can influence ideal positioning. People with sleep apnea may need to keep their head slightly elevated, which requires adjustments to the alignment of the entire spine. Those with reflux may not tolerate lying flat, requiring a subtle elevation of the entire torso. It is essential that these conditions be considered when implementing positioning corrections. Specific precautions and contraindications include avoiding this technique immediately after recent abdominal or lumbar surgery. The postoperative period requires specific positioning recommended by the surgeon, and any modifications should be discussed with the medical team. People with large or unrepaired abdominal hernias should be cautious about leg elevation, as this can increase intra-abdominal pressure and exacerbate the condition. Individuals with serious circulatory problems, such as active deep vein thrombosis or decompensated heart failure, require medical evaluation before implementing significant changes to leg positioning during sleep. While leg elevation is generally beneficial for circulation, certain conditions may have contraindications that only a qualified medical professional can properly assess. Older adults with dementia or other cognitive conditions may have difficulty adapting to changes in positioning and may inadvertently remove supports during the night. In these cases, it may be necessary to use larger pillows or positioning systems that are more difficult to move, always ensuring the person's safety and comfort. It's crucial to seek medical help immediately if sciatica pain suddenly worsens, leg weakness develops, changes in sensation, or problems with bowel or bladder control. These may be signs of severe nerve compression that requires urgent medical attention. It's also important to seek medical advice if sciatica is accompanied by a fever, which may indicate an infection, or if there's a history of cancer, as sciatica can occasionally be a symptom of bone metastases. Elderly individuals should seek medical reevaluation if there is no significant improvement after 4 to 6 weeks of consistent implementation of the correct positioning technique. While many cases of sciatica respond well to postural corrections, some may require additional interventions such as specialized physical therapy, specific medications, or, in rare cases, more invasive medical procedures. The recommended implementation protocol begins with an honest assessment of your current sleep setup. Take photos of your current pillow placement and sleeping position for a visual reference. Implement one change at a time, starting with lumbar support for 3 to 5 nights, then adding leg positioning corrections. Keep a simple diary of your sleep quality and pain levels to monitor your progress. During the first week of implementation, experiment with different lumbar support thicknesses to find the one that provides maximum comfort. In the second week, adjust the height of the leg raise as needed. By the third week, you should begin to notice consistent improvements in sleep quality and reduced morning pain. If discomfort persists after 2 weeks, consider consulting a physical therapist specializing in geriatrics. If you found this video helpful, please click the like button. This helps me understand what kind of content truly makes a difference in the lives of people suffering from sciatic nerve pain. Your like is crucial for me to continue producing quality content specifically tailored to the unique needs of seniors. Leave a detailed comment sharing your experience with sciatic nerve pain at night. Tell me how long you've been suffering from this condition, what methods you've tried before, and most importantly, describe your current sleeping position. Your comments not only help me create more targeted content, but can also help others in our community who are experiencing the same thing. Subscribe to the channel and turn on notifications because I regularly publish specific content on natural sciatica pain treatment for older adults, addressing the unique challenges and peculiarities that come with aging. You don't want to miss this valuable information that can transform your quality of life. Share this video with someone who also suffers from nocturnal sciatica, especially if they're over 60. Often, our family and friends suffer in silence from this condition, and information like this could be the first step toward the solution they've been searching for. Sharing it could be the gesture that changes someone's life. And let me know in the comments what sciatic nerve topic you'd like to see in the next video. I'm always striving to create content that answers the real questions and needs of our community of seniors seeking natural and effective solutions for sciatic pain. Your suggestion could become the next video that helps thousands of people find the relief they've been searching for.